Hello, today we'll be discussing how stress can impact heart health. We will start by outlining some general information and then look at how stress can impact heart health in women specifically. Stress is a universal feeling that can stem from issues at work, home life, or other day-to-day responsibilities. However, it's usually a fleeting feeling for most. For others, stress can be chronic, or in other words, constant and long-lasting. According to the American Heart Association, chronic stress can have a negative impact on your heart health. In particular, stress can increase inflammation in your body, which can lead to high blood pressure and also pose a risk for heart attack and stroke. Research studies have suggested that high levels of cortisol, which are stress hormones, can increase blood cholesterol, triglycerides, blood sugar, and blood pressure, which are all common risk factors for heart disease. Stress has also been linked to promotion of plaque buildup in the arteries. Things you can do to help limit stress include exercising regularly, spending more time with loved ones, getting good sleep, using meditation and relaxation techniques, and finding hobbies to distract yourself from negative thoughts. It is also important to note that one should consult their doctor before making any sort of lifestyle changes.
So now let's take a look at how stress impacts women's cardiac health, with recent research pointing towards a connection between the levels of stress and heart disease. So aside from the sweat that's dripping down your back or the headache brought on by stress that you may experience, there are numerous adverse stress-induced cardiac outcomes that can occur. The Journal of the American Heart Association states that stressful life events and social strain, which can be thought of as the negative aspects of social interactions or relationships, they've been found to increase a woman's risk of developing coronary heart disease by 12% and 9% respectively. And this is because stress can intensify cardiovascular inflammation and reactivity, which results in a metabolic change that increases the risk of developing coronary heart disease. And the findings from a few studies do indicate that this link is stronger in women than in men. So why are women at a higher risk for adverse cardiac outcomes when it's related to stress? Well, as of right now, the basis for this predisposition is unknown. However, there are a few hypotheses as to why young women might be more prone to stress-induced myocardial ischemia. Sex-specific hormones may be operative, including estrogen, progesterone, and an absence of testosterone, which influences coronary vasoreactivity. Moreover, when compared to men, women have higher levels of psychological risk factors such as early life adversity, post-traumatic stress disorder, and depression that have been recorded. Emotional or psychological stress potentially contributes to heart disease in many ways, from influencing heart disease risk factors to affecting the development of atherosclerosis, which is the hardening of arteries, to triggering heart attacks as well. It also may impair the recovery, future health, and quality of life of patients who have already developed the disease.